Protrusion of the mucous membrane of the nose and the paranasal sinus, what is that called as? It is called nasal polyp. So this is how typically a nasal polyp looks like. In children it can occur. Similarly, we have a lot of air sinuses. What are the various air sinuses that you know? Ethmoid, frontal air sinus. We get headache now when we get common cold because sinusitis occurs. So ethmoid, right? Maxillary. So these paranasal sinuses also, there can be development of a protrusion of the mucosa, which is called as polyp, is what you need to remember. Very good. So nasal polyp is that hypertrophied, edematous, prolapsed mucus of the nose and the paranasal sinus. It is grey in color, it is glistening, it has a smooth surface, it is pedunculated. So a polyp, if it is having a stalk, that is called pedunculated. Pedunculated is a word, right? It is insensitive to pain. It is mobile. If you happen to move, if you move this, it can be mobile, and it does not bleed. Typically, a nasal polyp, it does not bleed if you are trying to probe it. These are the features of the polyp. Now, what lead to the development of these polyps is a very important question. So, people who have allergic rhinitis, fungal sinusitis, asthma patients, they have the development of the polyps. Cystic fibrosis patients have polyps, right? Cartigenous syndrome, in these patients, they have tendency for nasal polyps. So what is cartigenous syndrome? Typically their bronchi. So what is a bronchi, sister? Trachea become bronchi, right? This bronchi can develop, the wall of the bronchi typically develop pouches, dilatation. That's called bronchiectasis. So they can have bronchiectasis, chronic sinusitis, and typically there are cilia in our epithelium, respiratory epithelium. Their cilia cannot move. That's called ciliary dyskinesia. So cartigenous syndrome, nickel, exposure to nickel, a lot of times in the ornaments, nickel is there. So there are all the various causes for the development of the polyps. Mainly you should remember allergic sinusitis, asthma patients have a tendency to form the nasal polyps is what you should basically remember.